Imagine running across a rocky landscape when your foot slips. You fall hard. There is a sharp crack. You try to stand up, but your leg immediately collapses underneath you. Today, that means an ambulance, an x-ray, painkillers, a cast, maybe surgery, and several weeks complaining about how slowly bones heal. But imagine the same injury 30,000 years ago. There is no hospital, no doctor, no x-ray, no metal plate holding the bone together. And your group may need to move again in a few days. For an ancient human, a broken bone was not just an injury. It could completely change whether you were able to find food, escape danger, stay with the group, or survive the next winter. So what actually happened when an ancient human broke a bone? First, not every fracture was equally dangerous. A broken finger was very different from a broken femur. A cracked rib might be painful, but manageable. A badly broken leg could make walking almost impossible. And then there was the worst kind, an open fracture, where broken bone or a deep wound exposed the injury to the outside world. Without antibiotics or sterile surgery, infection could become a bigger threat than the broken bone itself. But humans have one enormous advantage. Bones can repair themselves. When a bone breaks, the body begins building new tissue around the fracture. Over time, that tissue hardens and remodels. If the broken pieces remain reasonably aligned and the person survives long enough, the bone can eventually become strong again. Ancient humans did not need to understand cells or bone biology to notice this. They only needed to see it happen. Someone injured their arm. Weeks passed. The swelling decreased. Movement slowly returned. Eventually, that person could use the arm again. Over generations, people would have learned one extremely important lesson. A broken limb needed protection. If you keep moving two broken pieces of bone against each other, healing becomes much harder. So what could ancient humans do? They had branches, bark, animal hide, leather straps, plant fibers, grass, and a very good reason to stop the injured limb from moving. Simple splints could theoretically be made by placing straight pieces of wood along an injured arm or leg and securing them with soft material. The problem for archaeologists is that wood, hide, and plant fibers usually decay. A stone tool can survive for tens of thousands of years. A prehistoric splint usually cannot. So we cannot look at every healed prehistoric fracture and confidently say, this person wore a splint. But humans who understood how to bind tools, construct shelters, make clothing, and attach stone points to wooden shafts certainly had the materials needed to immobilize an injury. That creates another problem. Ancient humans could not always rest. Many prehistoric groups were mobile. They followed animals, moved between seasonal resources, searched for water, and relocated camps when conditions changed. If everyone needed to travel 20 kilometers and you could not walk, the entire group suddenly had a serious decision to make. Leave you behind? Stay and risk losing access to resources? Or somehow move you with them? This is where prehistoric skeletons reveal something fascinating. Some ancient humans survived injuries that would have made living completely alone extremely difficult. One of the most famous examples comes from Shanidar Cave in what is now Iraq. A Neanderthal known as Shanidar I lived roughly 45,000 to 35,000 years ago. His skeleton tells the story of an incredibly difficult life. He had suffered serious damage to the left side of his face and head. His right arm was withered and severely impaired, and part of it was missing. His right leg was also affected, and one of the bones in his right foot had been fractured. But here is the important part. The fracture healed, so did other injuries. Shanidar I did not survive for a few hours after being injured. He lived for years. Scientists estimate that he reached somewhere around 35 to 45 years old, an advanced age for a Neanderthal. A person with those limitations would have had difficulty performing many physical tasks normally, yet he survived. That strongly suggests he was not doing everything alone. Other people were probably providing food, protection, assistance, or at least allowing him to remain within a functioning social group. A broken bone, therefore, tells us something much larger than how ancient humans handled injuries. It tells us how much they depended on each other. Imagine breaking your leg during a hunt. At first, someone has to get you back to camp. If you can still put some weight on the limb, 2 people might support you while you move slowly. If you cannot walk at all, things become much harder. People could potentially carry an injured person using their arms, shoulders, hides, wooden poles, or some kind of improvised support. Again, prehistoric stretchers made from organic material would rarely survive archaeologically, but transporting someone did not require modern engineering. It required people willing to spend energy helping another member of the group. Once back at camp, the injured person now had another problem: food. Someone with a broken leg could not hunt normally. They might struggle to collect water or fuel. Even walking to a nearby resource could be difficult. For weeks, perhaps months, they could consume more than they produced. From a purely individual survival perspective, this seems like a problem. But humans did not survive as isolated individuals. A hunter who could not hunt today might recover and hunt again later. A skilled toolmaker could still work while sitting. An older person might possess valuable knowledge. A parent still mattered to their children. And sometimes people probably helped each other for the simplest reason of all: they cared. This does not mean prehistoric life was one giant supportive family. Conflict existed, violence existed. People could certainly abandon others. We cannot assume every injured ancient human received excellent care. But healed injuries show that at least some people survived long enough for serious damage to repair. And healing a major fracture takes time. During that time, the group becomes part of the treatment. But what did the actual healing process look like? Probably painful. Very painful. Ancient people may have used plants and other natural substances to manage pain, but identifying exactly which treatments were used tens of thousands of years ago is extremely difficult. Knowledge of medicinal plants existed in ancient populations, but we should be careful about imagining prehistoric pharmacies where every plant had a known medical purpose. Much of medicine would have been observation, experience, tradition, and experimentation. Sometimes it worked, sometimes it probably did absolutely nothing. And sometimes the treatment may have been worse than the injury. The body still did most of the actual repair. The group's job was to keep the injured person alive long enough for that repair to happen. That meant food, water, warmth, protection, and preventing the injury from becoming worse. If the bone healed in the correct position, the person might eventually return to near normal movement. Movement can remain limited. Pain may continue for years. Today, doctors use X-rays to see exactly where the fracture is and can reposition the bone before fixing it in place. Ancient humans had to judge everything from the outside. They could see swelling. They could feel that something was wrong. They might notice that a limb was bent in a direction it definitely should not be bent, but they could not see what the broken bone looked like underneath the skin. Trying to straighten a badly displaced fracture would also have been extremely painful and potentially dangerous. So even when someone survived, they might never fully recover. A healed fracture could permanently change the way they walked, hunted, climbed, or used a tool. And some fractures were simply too severe. An open fracture could become infected. A person could survive the initial accident only to become dangerously ill days later. This was one of the biggest differences between ancient trauma and modern trauma. Today, an injury may look dramatic, but still be highly treatable. For ancient humans, even a relatively simple injury could begin a chain of problems. You cannot walk, so you cannot gather food. The group must help you. Then the weather changes. The camp needs to move. You slow everyone down. Your wound becomes infected. You develop a fever. Suddenly, one bad step 3 weeks earlier has become a survival crisis for several people. This makes healed prehistoric injuries even more impressive. At the Cro-Magnon rock shelter in France, several early modern humans show evidence of serious health problems and injuries. Someone with a significant head injury may have required time and protection before returning to normal activity. Again, the skeleton does not tell us exactly who helped her, what they fed her, or what treatment she received, but it tells us something happened after the injury. She survived. The same pattern appears elsewhere across human prehistory. Broken bones healed, wounds healed. People lived with disabilities. Some survived for years despite conditions that made independent survival difficult. This challenges an old stereotype of prehistoric life. Ancient humans were not simply abandoning anyone who became temporarily useless. At least some groups invested time and resources into injured members. And that behavior may have been one of humanity's greatest survival technologies. Not fire, not stone tools, not spears, other people. Because sooner or later everyone gets injured. The strongest hunter can fall. The fastest runner can break an ankle. Keeping them alive could benefit the entire community, and eventually the recovered person could return the favor. That creates something much bigger than medical care. Compared with many animals, we are not especially fast, heavily armored, or difficult to injure. One slippery rock can take a healthy adult out of action for months. But humans developed a solution. We became very good at keeping each other alive. So what happened when an ancient human broke a bone? If the fracture was minor, they might rest it, protect it, and slowly return to activity. If it was serious, other members of the group may have needed to carry them, feed them, protect them, and change their plans while the bone healed. Some recovered completely, some lived permanently with the damage, and some never recovered at all. There was no guarantee, no hospital, no x-ray, no orthopedic surgeon, just a body trying to repair itself and a group deciding whether to give it enough time. Subscribe to Anciently Human for more stories about life before comfort, explained simply.